soon. So what's going on? Dr. Ashok Seth, cardiologist and chairman of Fortis Escorts Heart Institute, joins me this evening. Dr. Praveen Chandra, chairman for Interventional Cardiology and Structural Heart Diseases at Medanta Medicity, and nutritionist Dr. Shikha Sharma also joins me this evening. Thank you so much to all of you. Dr. Ashok Seth, would we still link these instances of cardiac arrest at an early stage largely to lifestyle issues? Dr. Ashok Seth, can you hear me? I'm not too sure if he's able to hear me. We're going to try and check that connection. Dr. Praveen Chandra, good evening to you. Are you able to hear me? Yes. If you could actually share your insights on that.
Incidence of heart attacks and sudden cardiac deaths in younger individuals. So let me tell you, the problem of heart disease and the problem of increasing incidence of deaths are happening maybe because of various reasons. Earlier we knew that those people who have diabetes, those who are increasing age, those who are having high blood pressure, those who have high cholesterol levels and are smokers were at risk of having a heart attack or a sudden cardiac death. And now we have seen that there are additional risk factors, which was seen in one of the very important studies, which was the Inter-Heart study, which said that those people who are not walking enough or working out enough, that means lack of physical exercise, lack of fruit and vegetable intake, adequate amounts of fruit and vegetable intake, and increasing mental stress. That is also one of the factors which leads to early onset of heart disease. And although I do not know in Siddharth Shukla's case whether he had any of these risk factors or not, but certainly smoking, I don't know also whether he was smoking or not, but smoking is a very important risk factor in younger individuals. And even if they do not have a heart artery blockage, they can develop a heart attack, which can be fatal at times. So that is one of the very important issues, which is really needs to be taken care of, and it's a matter of prevention actually.
Okay, so let's just then break it down. Dr. Ashok said, so for example, a lot of the cases that I cited are from walks of life, professions which are supposed to be high pressure. Whether it's the entertainment industry, for example, their routines are all over the place. In certain roles, Dr. said they'll have to gain weight, then lose weight. There's always, the added access and temptation to all kinds of vices and substances. Despite the fact that they all look so fit, is there a possibility that they were perhaps not genuinely that fit?
So, can you hear me now?
Yes, I can.
Anvi, can you hear me? Oh, that's better. So firstly, of course, we were all shocked at this young man's, Siddharth Shukla's death. We feel sorry, condolences, but it's, sometimes these are harsh reminders of what realities are and how heart disease has increased in the youth in this country over the last 15 years by 300%. And we have become, by the way, the world's capital of heart attacks, as you perhaps know by this time. 50% of world's deaths happen here. The other reason why we're seeing deaths at younger age group is for two important reasons. And while I don't go into the causes or the usual causes, when we are getting heart attacks at a younger age, 10 years younger than the West, and when more heart attacks happen in the young, when a lot of them would present not just as major heart attacks, but as more of a cardiac death, because 50% of the deaths from heart disease actually occur as sudden death. Now, you really asked an important question. Is just because we exercise and just because we bodybuilding and just because we look fit, and I'm not saying this for Siddharth, I'm just an important perspective about heart disease to the public and audience, is the fact that building muscles, actually looking fit, is not necessarily heart health. Heart health is totally different. For example, if I can build muscles, all I'm doing is actually physique, but that is neither good cardiac exercise. In fact, in many ways can be detrimental, and that's why you hear of some situations of extreme exercise landing up in heart attacks. And finally, it's very important to realize that you may actually harbor blockages which are early, which can be 30, 40%. Blockages do not cause any symptoms till they get beyond 70%. And these blockages get worse, suddenly lead to heart attack, and suddenly lead to cardiac death in situations of extreme exercise, smoking. And by the way, even pollution and increasing pollution has actually been known to create heart attacks. And perhaps that's one of the reasons for the increase which we see in the last 10 years. Even today, a study presented said that we probably decrease our lives in some of the urban cities by close to 15 to 20 years just because of pollution itself, which is known to harm coronary arteries and known to create heart attacks. So it's so important to start understanding that fitness and heart health are two different issues. And these occasionally, when we see athletes, footballers, an exercise freak, suddenly dropping and having a heart attack or suddenly actually having a cardiac death, it brings to mind that checkups of heart are very important, especially in those who have got a family history of diabetes, who are a smoker or live stressed lives, or actually are in extreme physical exertion, sports or fitness routines.
Actually, yes, I wanted to, just take that point across to Dr. Chandra. Again, Dr. Chandra,